My name is Jennifer Short, and I'm pleased to present to you the evolution of nursing informatics. Merriam-Webster Dictionary describes informatics as a noun that means information science. Health informatics is the field of science and engineering that aims at developing methods, technologies, and processes. It studies patient data that is mined from many different sources and modalities and puts it all together in such a way that a clearer picture of a patient and their health status emerges. With this in mind, nursing informatics simply integrates all of the previous with nursing science and nursing theory. Nursing informatics has helped shape the face of modern nursing. Nursing informatics assists millions of nurses in making informed decisions about patient care every day. Let's take a closer look at just what nursing informatics is. It can be broken down into three separate scientific disciplines. The first of these is nursing science, which is just a basic science like biology. Nursing science, however, is the study of principles and application of nursing. It forms the scientific foundation for professional nursing practice. Next is computer science. Computer science is the study of computational systems and algorithmic processes, including applications, hardware design, and their impact on society. Computers are a part of our everyday lives, and having a basic understanding of them is crucial in nearly every modern profession. Finally, there is information science. Information science is the discipline that investigates the forces governing the flow of information, the properties and behavior of information, and the means of processing information for optimum accessibility and usability. When these three distinct disciplines merge, it gives us nursing informatics as we now know it. Widely regarded as the mother of modern nursing, Florence Nightingale is also a pioneer of nursing informatics specialists. During the Crimean War, Nightingale was horrified by conditions of the wounded. She improved hygiene standards, nutrition, and supply chains, and through record keeping, she was able to determine she helped improve the death rate from 42% to 2%. Nightingale gathered and analyzed health data to a degree that she became known as a passionate statistician. Because her gathered data was utilized for healthcare, she is considered the first nurse informaticist. Although the methods by which she conducted data collection looks very different to when she was pioneering the field, her contributions are immeasurable. Here's a brief timeline of the evolution of nursing informatics. As mentioned on the previous slide, the 1850s saw the beginnings of the discipline. It would not receive its name for almost another 130 years when, in 1980, Dr. Marion Ball first coined the term. In 1992, the American Nurses Association recognized nursing informatics as its own specialty. In 2004, President Bush wanted to see a streamlined electronic medical health record to replace the archaic paper charting system in place at that time. He rationalized that having a digital record would save time by not having to have paper copies faxed or even mailed, and vital information would be readily available. In 2010, the Affordable Care Act, also sometimes referred to as Obamacare, was introduced. It made healthcare more accessible and equitable. It also created a digital marketplace for health coverage and expanded Medicaid. Government regulations began affecting nursing informatics long before the ACA was signed into law. Way back in 1996, the Health Insurance Portability and Accountability Act came to be. This was to ensure that privacy was properly protected. It is a national standard that protects sensitive information from being shared without the express consent of the individual it pertains to. In 2015, lawmakers passed the Medicare and CHIP Reauthorization Act, or MACRA. This affects payment models and incentivizes good outcomes with the Quality Payment Program. The Quality Payment Program rewards high-value quality Medicare clinicians with higher compensation. Similarly, poorly performing practitioners would receive a reduced payment for services rendered. Nurse-led innovations through technology. We've seen streamlined processes like automated tasks, documentation, scheduling, medication management. It reduces the paperwork and puts the nurse at the bedside more. It enhances communication with real-time collaboration, secure messaging, and it promotes efficient and effective communication for better health care. And personalized care provides access to comprehensive patient data and documented medical history, preferences, and care plans. Since the advent of nursing informatics, and certainly in the continued improvement of it, the nursing profession has witnessed many positive consequences. One of the best examples of this pertains to patient safety. Having an electronic medication administration record, or EMAR, has saved countless lives by flagging potential drug interactions, allergies, and catching medication errors when scanning barcodes for administration. People spend less time in the hospitals and are at lower risk of being admitted with electronic health records. With all of the data mined and stored so accessible, we are more easily able to develop best practices to adhere to. Accurate data and record keeping make research so much easier. Through research, we develop evidence-based practices that shape workflows to be optimized for efficiency and safety. We are then able to impart that knowledge to the next generation of nurses. When we know better, we do better, and we teach better. Want to get into nursing informatics? Not sure how? The first step is to go to nursing school and get your nursing license. If you're listening to this or reading this, you already have that. Just like you already have your BSN if you're reading this, considering this project is an effort within a master's program. Anyways, you need a bachelor's degree in nursing. The industry standard is to have at least 3 years of clinical nursing experience, and usually 1 year of that is preferred to be med-surg experience. At this point, you're ready to begin your nursing informatics journey. Things will set you apart from competition and make you more marketable, include an advanced degree and or certification by passing an ANCC exam. So how much do nursing informaticists make? In my home state of West Virginia, an entry-level informaticist makes just under $57,000 a year, or about $27-23 an hour. The average annual salary for nursing informaticists in West Virginia is just over $70,000. Top earners hover around $120,000 a year. And just for a little bit of context, West Virginia has the lowest price per square foot for a home at $120 per square foot. The median price for a home is $118,000. We are one of the poorest states in the union. Thank you for listening to my presentation.